Hello and welcome to today's episode of the Pareto podcast. My name is Camille and I'll be hosting today's episode. The Pareto podcast hopes to bring interesting and insightful guests who can share their valuable experience working in a wide variety of healthcare settings. The insight they bring and the illumination that it gives to you, the viewer, will hopefully bring you insight and interesting topics that you can base your own careers on. So today we definitely have an interesting guest with us joining on our episode. We have a physiotherapist who upskilled into a trainee ACP, a good friend of mine also, Mr Sikandar Kiani, who will be sharing his insights into the world of physiotherapy and then, broadly speaking, into becoming a trainee ACP in the modern NHS. ACP training has evolved in recent years and he'll share his experience of how he found the transition, how he found the modern curriculum, and also his insights as well. So welcome, Mr Kiani.
Thank you for the introduction.
So, we know each other well, but just as a brief couple of sentences for the benefit of the audience, if you'd like to introduce yourself and what your current scope of practice is as well.
Yeah, so I'm Sikandar Kiani and background as a physiotherapist, and 2 years ago I started the Trainee ACP course.
So for the audience benefit, some quick fire questions, no more than 50 words per answer please, and we'll get you into the flow. So first of all, as a physiotherapist, your favourite joint in the body?
My favourite joint has to be the shoulder.
Why is that?
Just because of its complexity. There's many attachments, there's many muscles, tendons, things, and it can be quite a complex joint to treat, but also quite rewarding when you get it right.
Very good. As a physiotherapist, what is the most difficult and stubborn injury that you treat?
I think again, shoulders.
Fine.
Especially within the elderly when they come in with a degenerative tendonitis or something like that. It can be quite difficult to treat just because they're in a constant phase of healing, repairing, but as you get older things don't repair as well as they usually do when you're younger.
All right, so here's a quick one. What can a person do to help their bone and muscle health in terms of their daily living? What's the best thing you'd advise?
So there's probably 3 things that I would recommend.
Okay.
The first one would be just to make sure there's an element of weight bearing or resistance exercise and muscle strengthening.
Okay.
The second thing would be diet. So you want to make sure you're having plenty of protein, plenty of vitamin D and vitamin C.
Okay.
So the third thing would be to avoid prolonged immobility or
Okay.
immobilization, just to ensure people are keeping active and not being sedentary.
Perfect. In terms of your day-to-day physiotherapy work, what kind of demographic is the most challenging to deal with in terms of getting the rehab done and getting them back to the baseline?
Yeah, I think the most challenging is working with elderly patients. And this is because certain exercises need to fit around their routine, so it's not as simple as giving them 3 exercises and making sure they're doing it 3 times a day. We need to give them exercises that will fit their daily routine, but also exercises that will fit their requirements, whether it's their ADLs or if it's a specific hobby they've got. It can also be challenging if they've got issues with memory or cognitive impairment. That can be quite challenging.
Absolutely. And final thing, I'll push you for one only answer this time.
All right.
What is the most challenging aspect of transitioning from a physiotherapist to a trainee? What we found the most difficult?
So I'll give you more than one word, if you don't mind. But it's probably the learning curve.
Okay.
I'd say is the most difficult part.
Oh, very good. So that's some insights into some challenging questions I asked there, quick fire round. So hopefully you got some benefit from that. So we understand from your work as a physiotherapist, but today's podcast will focus, I think, on the ACP role and how that has developed in recent years and how your background has helped you transition. I think from our perspective, it just brings a lot of insight into the views that maybe physiotherapists themselves and are interested in perhaps upskilling into becoming advanced clinical practitioners as well. So if you don't mind, we'll focus on that today.
Sounds good.
So just going back a little bit, tell us about your journey as a physiotherapist, how long you were working as a physiotherapist, and what drew you into the world of advanced practice in particular.
Sure. So very briefly, I started on the Clinical Sciences Foundation year, hoping to go into medicine. Through that year, I think I fell out of love with the idea of becoming a doctor. And what I did enjoy was the anatomy and physiology. And I think I looked towards physio at that point. 3 years of physio, and after working as a physio for about 6 years, specialising in neuro rehab, specialising in elderly care, I really wanted to upskill myself, and there was limits to where I could go as a physio.
Yeah.
More managerial responsibilities. I wanted to stay clinical, and the ACP route opened that door for me and made it possible.
I think even with our previous guest, we found the theme of, wanting to develop your career and choosing one of three options. Either you're going to upskill clinically in terms of advanced practice, you're going to go into research, you're going to go into management, or you're going to go into teaching. So that's one of the options that becomes available to you, and perhaps these are some common themes that you can see across the episodes. So in particular, the ACP role, you found that the application process, was that quite straightforward? Did you feel confident in your abilities to progress in ACP? Were you encouraged? How did that come about?
So within my role as a frailty specialist physio, I worked with ACPs quite often. I had good ACP mentors, which really encouraged me to go for the role. It allowed me to do more than I did as a physio, and it allowed me to guide treatment and management with regards to pharmacology. It allowed me to make more clinical decisions and diagnoses for the patients. And so as a trainee ACP role, it's an apprenticeship.
Yeah.
So the job is applied for. So you work as a trainee ACP and you part-time do university studies as well. So did that make, obviously in life you're at a different stage now. You're due to welcome a new child as well. So congratulations for that. So, as part of a family man, does it fit better into your lifestyle, this kind of training and upskilling model? So I think for any mature student, either doing a master's or doing an ACP course, you're at a different stage in life. You're not 18 anymore. You might have kids, you might have a house and things that demand your attention and time. And it's very difficult to divide that time between work, studying and family and any other responsibilities you might have. So I find that's probably the most difficult part of studying and going on to the ACP. So not to put words in your mouth, but do you feel like this approach ticked quite a lot of boxes for you going into the ACP role? I definitely think it did. It allowed me to develop my clinical skills. It allowed me to be more autonomous than I am as a physio. It also allows me to continue to enjoy the clinical aspect of work, which I feel I wouldn't have as a physio in the area I was in. Fine. So it's quite an interesting, development of someone who was working in physiotherapy for a number of years and developed into the ACP role. So in terms of yourself, bridging that gap, you've already mentioned that it can be quite challenging coming from someone of your background. Did you feel that in terms of your cohort, were many physiotherapists, or what was the majority of your cohort, your peers that were studying alongside you? So the majority of my peers were nurses by background. There was 3 physiotherapists in my cohort and a podiatrist and a pharmacist as well. And I definitely found, from a physio perspective, I was advantaged with my clinical assessment, pathophysiological knowledge. However, going into acute medicine, there was definitely a steep learning curve. And looking at the diagnoses of various conditions, I found that quite challenging. Yeah, I suppose with that mix of professionals, you can see how different people will be able to help in different ways in terms of anatomy, pharmacology, perhaps from the pharmacist, and as a group it can develop your skills together. Definitely. I definitely think as a group it helps. So the nurses were pretty good at medicines or understanding medicines because they spend their lives administering them. Pharmacists, they know all about medicines. So together, having joint revision sessions definitely helps. Very good. So we've already mentioned, of course, your shift and the types of perhaps upskilling that you needed to have. Was there anything, particular resources that you lent on during this transition period, for example? Were you reliant on your mentors, textbooks? What kind of resources did you utilize to perhaps bring you up to speed with some of your cohort that were perhaps more efficient in other areas of medicine? So resources definitely helped. Things like the Pareto education webinars definitely help. Having a good clinical supervisor, so people like my consultant, definitely helps, given their years of knowledge and insight. But also having the peers around you, pharmacists to nurses, they were able to give me that push. And in terms of, so for example, a week in the life, let's call it, maybe, it's difficult to summarize an entire, 3 year, you mentioned it's a 3 years master's program. But typically, how much time would you spend revising? How much time would you spend on,
actually seeing patients? How much time would you spend in university, typically on an average?
So typically on an average week, we would complete 37 hours, 37 and a half hours. So majority of that time will be on the shop floor clinical.
Okay.
So this will be in your first year supervised by your ACP mentor or clinical educator, or in your second year, slightly more independent,
Fine.
seeing patients yourself. So perhaps 2 to 3 12-hour shifts, and then 1 day at university.
Fine.
So there is scope to do more revision outside of that, perhaps 2 to 3 days free. However, that's revision, that's family, that's any other jobs you need to do outside of being an ACP student.
So it's about a balancing act. And have you found within the last couple of years while you've been in this ACP role, you've managed to do well, or what advice would you pass on to our viewers who are perhaps looking to study into the ACP role?
So I think it varies from year to year. The first year, the main challenge is the OSCEs, and especially if you've had a lot of time out of education, actually developing or using that mind memory to get back into education is tough, especially with the steep learning curve. I think putting a lot of time into revising things pre-hand, doing a lot of pre-reading will definitely help. However, you do spend a lot of time in clinical practice, and I find that clinical practice definitely helps, especially for people who are visual and practical learners.
And so in terms of the assessment processes, you've got live feedback. What other sort of assessment are you getting regularly to ensure that you're keeping on pace with the learning that's expected from you? What are the elements of assessment?
So within university, you've got your elements of assessment, which include your assignments, your practical OSCE exams. You've got your prescribing pharmacy exams.
Okay.
And you have regular tutorials with university, but also when you're working as a trainee ACP, your managers will give you time to spend with other colleagues to boost that learning.
Of course. So you feel that it's quite a comprehensive system.
Definitely.
And ACP has been around for a number of years now, and I think a lot of the different elements have been ironed out, so to speak. Okay. So I know ACP is one of those rotational programs where you do spend some time embedded in different teams, and you'll get some insight into different specialties and perhaps pick up skills and knowledge. So what are the particular insights and knowledge you've gained from perhaps your surgical rotation or some other rotations that you would like to share?
Within the first year of my course, we do 3 rotations. So the first rotation was surgical. So that allowed me to have more experience in assessing and treating acute abdomens, having a hands-on feel of acute hernias. My next placement was A&E, so within the HDU and resus areas. And this allowed me to develop my skills of CPR and also ATE examination, which allows me to deal with acute traumas or acute presentations that come through the door.
Definitely.
And that definitely within my acute medicine, So within my role as an acute medicine trainee ACP, I can then use them transferable skills and knowledge in assessing acute abdomens or hernias within an acute medicine setting.
Of course, because patients and their bodies don't know what setting they're in. You can't get a surgical problem in medicine.
Someone comes through with a chest pain and it ends up being their abdomen. So we have to be prepared for it.
Of course. So general skill set is, widely acknowledged, appreciated. So I think that's why it's so important that they do send you on such a rotation. So it's brilliant that you got those skills.
And the great thing about it is that there's a competency format. So we have competency formats for surgery, for ED. So there's certain conditions on there that you will have to prove and evidence your competence. So this is supervised practice and supervised assessment on these areas.
So without, going into patient specifics, is there a recent case that you found that with your new founded trainee ACP skills, you were able to perhaps understand a lot more compared to a few years ago when you were a physiotherapist?
Definitely. One of the cases that really stood out was a patient who came in with shortness of breath, chest pain, pleuritic in nature. We worked him up for query PE. And there were many differentials we had to consider. It was sudden shortness of breath. Could he have had a pneumothorax with a pleuritic chest pain as well? Could it be ACS? And with my knowledge and the development of my knowledge over the past year and a half, 2 years, we were able to diagnose a PE.
Okay.
However, the difficulty comes when the patients are then assessed by numerous consultants and there's varying opinions. I think having a firm grounding on patient history taken is very key, and also I've learnt the importance of a good examination, which is imperative.
Which of course is one of the cornerstones of clinical medicine. Very good. So perhaps a little bit more can you share an example where your knowledge as an ACP has benefited your patients in terms of their clinical outcomes and in terms of what you can do as a trainee ACP now compared to what your skills and knowledge were as a physiotherapist?
Sure. I think expanding as an ACP has developed my clinical knowledge, especially on pathophysiology. So with physiotherapy, we know all about bones and joints. Now we have to start thinking about the heart, kidneys and the liver, for instance. And that can be quite challenging, but the university sets you up well to help the learning in regards to that. There's initial uncertainty when it comes to certain conditions because of the varying differentials when diagnosing patients, and that has also been something that I've had to really put time into, understanding certain clinical conditions to a level of depth.
Yeah, because as compared to physiotherapy, when you're focusing on the musculoskeletal system, you're developing a lot more holistic involvement with the patient.
Sure.
And have you ever been in a situation where perhaps in your role as an ACP, you've relied on some of your physiotherapy knowledge where you've advised certain exercises or certain techniques, certain insight that you could bring to your patient as well?
Definitely. We get this all the time, especially working on SDEC. Okay. We have patients coming in with chest pain. Now, chest pain, the first thing we're thinking about is, could it be ACS? Could it be the heart? Or could it be the lungs? Could it be a PE? Yeah. However, a lot of the times, and quite often, we end up assessing the shoulder or the pecs, and it ends up being a musculoskeletal issue.
Okay.
So my colleagues would generally send these patients back to the GP.
Yeah.
However, I like to spend perhaps 5 minutes more and give them some exercises that they can go home with that will hopefully help.
I think that's the benefit of the multidisciplinary team, and different experiences, different backgrounds can definitely inject some well-founded knowledge, some experience into different clinical teams and overall benefit the patient. So that's really good. And you're coming towards the end of the ACP journey now. In terms of what are you most looking forward to after qualifying? Are you looking forward to prescribe, act independently? What's the goal here in terms of getting to the end?
I think having just done my prescribing exams, I'm really hopeful to pass, of course, but then going into my third year, hopefully I will be prescribing under supervision, and I'm really looking forward to that. It almost, instead of me asking someone else to prescribe a medication for me, it allows me to think deeper into the medication, its side effects, its interactions, and then allows me to prescribe that medication for the patient.
So it's interesting you say you're excited. Is it an apprehensive sort of excited, or you're looking forward to jump in?
It's a nervous, jittery excitement, definitely. I might start with paracetamol and see how I go from there.
Yeah, because I think in any sort of field, having that level of responsibility of prescribing is, of course, big responsibility. It's legally protected.
Definitely.
Can be involved with legislation. Legally can become an issue as well because it's your responsibility. And so it's something that shouldn't be taken lightly.
I think definitely to speak about the ACP course, we do the prescribing in the second year. So going into your third year, all your prescribing decisions are supervised.
Yeah.
So I think the fact that we do 3 years as a trainee ACP definitely helps build that confidence.
So by the time you get to the prescribing stage, you feel a little bit more confident in your decisions and you can back them a little bit more with some sound clinical reasoning.
Definitely.
So in terms of, if we have any physiotherapists watching now, so one of your background, perhaps they've done a few years into physiotherapy and they're considering their next career change, there's options, well-trained physiotherapists, there's options abroad, there's options in management, teaching, etc. But what particular tips would you give to someone who's thinking about the application into ACP? What are the sort of plus points? What are the sort of lesser talked about, I wouldn't say negatives, but lesser thought about elements of becoming into this field, committing, and that perhaps they should consider before writing the application form?
Okay, so the education and the learning is intense.
Okay.
But also the pressure of having more clinical responsibility for your patients compared to perhaps prescribing exercises for a patient.
And in terms of the rewarding side, where do you see your benefits, for someone that's thinking about applying, they're perhaps on the fence, what, from your experience, what's the most rewarding elements?
I think an ACP definitely gives more influence to a patient's prognosis or diagnosis. I feel like an ACP can guide a patient's treatment.
So tell me about some of the elements of being an advanced clinical practitioner that give you satisfaction in your job. What brings a smile? What keeps that fire burning? You're still in your early career, but what are the elements that you feel that you really look forward to?
Sure. I think one of the most things is building rapport with my patients and being able to spend time and delve into their clinical history and provide some time for them to have the relevant investigations and then hopefully develop a treatment plan and have a diagnosis for them at the end to go away with. Something that we don't quite have in physiotherapy. Yes, we assess and we diagnose and we build good rapport. However, as a physiotherapy, if I want an X-ray, for instance, or if I want an MRI scan, this is something I have to put back to the GP or something I may have to send the patient to A&E for. As an ACP, I can definitely influence that a lot more.
And you've got the privilege with your skill set and knowledge to adequately and appropriately refer the patient for relevant investigations as well.
Definitely.
So from what you're describing, it sounds like you can definitely use and develop and build upon your primary profession as a physiotherapist and use those skills to enhance your patient care that you're actually delivering on the front line. And that's a really important element that I think advanced clinical practice does give the ability for you to do.
Definitely.
What advice would you give to a physiotherapist who's been away from clinical education, perhaps would feel that, amongst their peer groups, they would struggle with the pharmacology and things like that, just to motivate them if they're considering ACP to actually take the step and apply?
Okay, so advice for physiotherapists that I would definitely give is don't underestimate your transferable skills. Physiotherapists come with a lot of autonomy compared to the allied health professionals. We assess, we treat and we diagnose musculoskeletal pathologies, even cardiorespiratory pathologies to a limit. I would also say be ready for the steep learning curve.
Okay.
Because again, we're not just considering muscles and bones, we're considering every organic system in the body.
Okay.
And I would also say find mentors and embrace that it will be a difficult 3 years.
So just going on to your point about mentors, did you reach out to any qualified ACPs that were already in the field just to ask them about their experience? Did you feel that helped perhaps on LinkedIn or other professional networking platforms, of course, are available? Did that help or?
So definitely. So with my role as a physiotherapist in the elderly virtual ward, we had a large team of ACPs, which I took mentorship from. I understood the role, I understood the demands of the course, I understood the demands of the job and what was involved, and they definitely helped and pushed me in the right direction.
And from my understanding of the ACP process and the application is quite competitive. So what do you feel from your application stood out to the team when they were looking for the next cohort of ACPs?
So the job I applied for was a trainee ACP role in acute medicine. Now, within the virtual ward, we had a lot of primary care dealings. We worked alongside the Yorkshire Ambulance Service. So I developed my skills within that role. As a physiotherapist, I was able to transfer my clinical examination skills and my autonomy. And I think that definitely helped. And as a senior physiotherapist, we had certain managerial roles, which also helped. So supervising. As a physiotherapist, I was in charge of supervising students and supervising other junior staff, completing appraisals and completing assessments, and that definitely helped.
Very good. So as a physiotherapist in acute medicine, that's what you trained up to do. Do you feel like you'll progress your career in acute medicine for now, or have you hopes of developing into a particular area of medicine or specialism?
Honestly, I really enjoy acute medicine. I'm really enjoying the complexity of the patients that come through. So I think for now, I'm happy to stay where I am.
But who knows for tomorrow, right?
Definitely.
I think that's one of the key things about ACP. It gives you some broad set of skills and you can actually further develop yourself and continue to develop.
And the good thing is there's a scope to go into primary care, but but I really enjoy secondary care at the moment.
Oh, very good. And I think the last question of today is, going back to your physiotherapy work, are you still keeping a foot in that world? Are you doing any physiotherapy work at the moment?
Definitely. I do some private neuro physio rehab for a company called Nicole Lavin Neuro Rehab Limited.
Okay.
So there we deal with traumatic brain injuries, people who have had spinal cord injuries, strokes, dementia, things like that. So I do that at least once or twice a week.
And do you envisage keep doing that going forward?
I will definitely continue doing that. It definitely keeps the excitement of having both roles.
I think one of the key things we found from today's episode, I'm sure you'll agree, is how, it's a benefit having your experience of physiotherapy into the world of ACP. Yes, it's been a challenge in terms of learning the massive steep learning curve. And yes, there's some elements that you were perhaps not as efficient as compared to your colleagues, but physiotherapy has given you that broad set of skills that you're developing into your new role. And I think that's one of the brilliant things about advanced practice. You can take what you know at the moment and continue to develop yourself. And it's one of the key elements of the modern NHS and how we're working at the minute to try and develop the talent that we do have and get those people that have the skills and have the attitude and have the aptitude to develop themselves. So it's been a really interesting and insightful conversation today, Sikandar. So I want to thank you for your time. And I'm sure the audience would agree you got a lot of insight from yourself.
I will say, for anyone that's looking to venture onto the ACP course, or anyone who is currently in the process, it does get easier.
Yeah.
It definitely does get easier.
Maybe you should say that to the camera directly. Tell the people.
So for anyone looking into becoming an ACP, or anyone who's on the journey through their trainee ACP course, it does get easier and there is light at the end of the tunnel.
Fantastic. I think we'll wrap you up there, and thank you so much for your time. We'll add some information, perhaps your LinkedIn profile, in the description. So if anyone wants to reach out, perhaps they're wanting some advice on their career path, perhaps a physiotherapist looking for the ACP role, are they welcome to contact you?
Of course they are.
Brilliant. So we'll wrap up there. Thank you so much for your time. That was another episode of the podcast. We hope to see you on the next Pareto podcast, where we will continue to endeavour to invite important, interesting and insightful guests. Thank you, and see you next time.